So good afternoon, everybody. I think we're going to get started. Welcome to the National Alliance for HIV Education and Workforce Development's webinar series, Bridging HIV and Substance Use Disorder Innovations in the Field. You'll note we have the chat open and we encourage you to interact both with our presenters and with each other as well. So please feel free to introduce yourselves with your name, organization, and what interested you today in joining today's webinar in the chat there. Next slide, please. So just a little bit about the Alliance, which is also known as NAHUD. It's a membership organization of the 8 regional and 2 national AIDS Education and Training Centers, the AETCs. It supports the AETC program mission. We were established in 2010. And we support the AETCs, which are a component of the HRSA-funded Ryan White HIV/AIDS program. And they have an explicit directive to build and maintain a well-educated and culturally sensitive health professions workforce that can provide prevention, diagnosis, care, treatment, and medical management for people at risk for and living with HIV. NAHUD collaborates with multiple organizations in order to promote and educate on the work of the AETC program. Next slide, please. One of those collaborations is with the Opioid Response Network. Since 2018, NAHUD has been funded by the American Academy of Addiction Psychiatry as a partner organization of the Opioid Response Network to address the intersection of HIV and opioid use disorder. ORN was created to support efforts in addressing the prevention, treatment, and recovery of opioid use disorder, and it provides free resources and technical assistance locally in communities across the United States and its territories. So please visit the ORN website for more information and or to submit a request for technical assistance. Today's program will be offering continuing education credits. There will also be a link in the participant chat towards the end of this session about the evaluation. So we really need you to complete that evaluation within 2 weeks of this seminar in order to get your credits. And we will be offering medical education, nursing, social work, and also a certificate of attendance if you need that, and not just the credits. So again, the evaluation is crucial to you obtaining those. And also we really appreciate your feedback, even if you're not getting credits. So we like to hear from you about the session, but also on future ideas for sessions coming up. So please fill out the evaluation as soon as possible. So without further ado, we can start our webinar on leveraging the National HIV Curriculum in improving treatment of substance use disorders. And I'm very pleased to welcome Dr. Maria Corcoran, who is an assistant professor in the Division of Allergies and Infectious Diseases at the University of Washington. She's the medical director of Aurora Clinic, a low barrier clinic focusing on HIV prevention for people living homeless. And she also attends at Harborview Medical Center's HIV and viral hepatitis clinics. She serves as associate editor of the University of Washington's Hepatitis B and C online learning curricula, and her research interests focus on novel strategies for expanding low barrier care and services to people who inject drugs. So welcome, Dr. Corcoran.
Thank you so much. Can you all hear me okay?
Yes.
Fantastic. All right. Well, it is a pleasure to be here with you this afternoon. Thank you to those on the East Coast who I know it's 4 p.m. on a Friday, so I appreciate you being here. I will be speaking on leveraging the National HIV Curriculum to improve treatment of substance use disorders in HIV primary care today. I don't have any financial disclosures. So the objective of this talk today is really to introduce you to the National HIV Curriculum and hopefully show you some tools that are present within the curriculum that might be pertinent to your work with people who are struggling with substance use disorder. So specifically, the objectives for my talk today will be to review the educational tools and content available on the National HIV Curriculum. You'll also see that abbreviated as NHC throughout these slides. I'd like to outline specific NHC resources for providers treating substance use disorder and people living with HIV, and demonstrate how to utilize substance use disorder tools and calculators that are available on the National HIV Curriculum. So first, a bit about the National HIV Curriculum. This is a federally funded free online curriculum that covers a multitude of different topics within HIV, really focused on HIV primary care. So topics including testing, general care and treatment, and prevention. Dr. David Spock here at the University of Washington is the editor-in-chief of the National HIV Curriculum, and he's also the editor-in-chief of the National STD Curriculum, Hepatitis C Online, and Hepatitis B Online, which are three of the other online curriculas that we offer, all of which are federally funded, free of charge, and offer CE credits. So what you're seeing here is just the landing page for the National HIV Curriculum. And I'm going to go through some of the features of this curriculum over the next few slides, and then we'll do more of a lifetime demonstration as well. So what are some of these features of the National HIV Curriculum? Well, it's aimed to be a comprehensive and up-to-date resource. So we go through updates frequently and make sure that content is updated as new studies or new recommendations and guidelines become available. As I mentioned, it is 100% federally funded and free of commercial bias. There are 37 lessons that are present within the curriculum, divided over 6 modules. And each lesson has a corresponding question bank, and we'll talk a little bit more about that in a second. As I mentioned, it offers free CME, MOC, CNE, and CE. And then there are also 18 clinical screening tools and calculators that are really popular on the website. It provides an in-depth overview of antiretroviral medications. There's a new section on mini lectures on clinically relevant topics and certain antiretroviral therapy. There's a section outlining 5 practical HIV symptom evaluation guides. And then one of the unique features of the curriculum is that it has an online learning group functionality, which means that organizations or divisions or departments can create a learning group within the curriculum and enroll people into that learning group and track their progress over time. And this has been used a lot for onboarding of new employees or training of individuals who may benefit from this curriculum while they're either stepping into a new role or expanding their role within their current clinic. And then in addition to being able to track the learning groups, you can also track your individual progress throughout the curriculum. And that's something that you can do if you register for the curriculum. So what are some of the general principles of the NHC? We aim for it to be a comprehensive curricula that addresses the spectrum of HIV clinical care, something that is relevant for a broad range of healthcare providers, not just physicians, and something that provides recommendations that are based on US federal guidelines. Really, the core of it is based around core competencies that are needed for providing care to people living with HIV, and we aim for it to be a free educational resource. As I mentioned, there's that dual functionality of the fact that you can track your progress throughout the curriculum, but you can also utilize this as a quick reference, almost like folks might utilize UpToDate or other online clinical reference tools. So the 6 modules cover a variety of different topics, and within these 6 modules are a total of 37 lessons spread between the different modules. So module number 1 will cover screening and diagnosis. There's a module on basic HIV primary care, antiretroviral therapy, co-occurring conditions, prevention of HIV, and key populations. And then across all of the lessons, there's a total of 97 free CME credits, MOC points, CNE contact hours, and CE contact hours, and then 70 pharmacologic CE for advanced practitioners. And then for individuals who would like, the University of Washington can provide a certificate of completion for the curricula. So for individuals who are interested in registering for the curriculum to go through and track their progress or to gain CE, there's a registration button in the top part of the curricula that will get you to this page where you can register with your information and also watch a site overview video that will provide just a brief overview of key features of the curricula. Learners who use the curricula oftentimes will go through these modules either asynchronously or synchronously, or they might just be going to look up one specific thing. But as I'll show you in a minute, you just hover over the course module section. You'll see that the 6 modules are listed here on the left-hand side, and we'll pull up all the different lessons within that specific module. Learners can either click on the quick reference links here, which will just pull up the module, or they can click on the self-study module, which will they need to be registered for and sign in, and then can track their progress and gain CE through those self-study modules. The lessons are outlined in a text-based format, broken up into chunks that are hopefully easily identifiable by titles and bolding. And then there's a number of different images and graphs to help illustrate some of the more complex topics. So as an example, there's oftentimes image series that we utilize to demonstrate some of the more complex clinical events or clinical concepts in HIV care, as demonstrated here as an example of HIV regional lymph node spread. Each lesson comes with a question bank, and while any user can access the question bank topics, you must be registered to be able to earn CME and CNE credit for these question banks. So upon completion of a question bank, the learner needs to answer 80% of the questions correctly in the topic to earn CE credits. And the number of questions generally correlates with the length and the content of the lesson, and then will correlate with the CE credits. So for example, 5 questions are equivalent to 0.5 CE, and 10 questions would be equivalent to 1.0 CE. One of the more popular features on the curricula are the clinical calculators, and we'll talk a little bit more about the substance use screening calculators here in a moment. But the curricula also contains other clinical calculators that are just pertinent for kind of everyday care. So one of the ones I use frequently is the creatinine clearance calculator if I'm looking to calculate somebody's renal function for dosing of a medication. And there's also some other calculators in there like the FIB4 and the APRI, which are used when trying to stage liver scarring and liver fibrosis prior to Hep C treatment. And then there's also some calculators for mental health, the GAD-2, GAD-7, which are used for anxiety, and then also PHQ-2 and PHQ-9, which are used for identification of depression. The curriculum similarly contains a very comprehensive list of antiretroviral medications. It's broken up by single tablet regimens, and then also broken up by medication class. And within each medication link, you can see that there's prescribing information. So for example, with dolutegravir here, we've got the FDA prescribing information. There's a tab for clinical trials, pertinent references, and then there are slide decks and teaching resources. So if you clicked on the teaching resources, for example, for dolutegravir, it would pull up a general slide deck outlining key trials for dolutegravir, and then you can see downloadable PDF and PowerPoint slides for the individual trials for that medication. And so that can be helpful if you're teaching with residents or medical students, or if there are other folks within your site of practice where you want to use some of those slides. They're available without permission, free of charge for all of the antiretrovirals. And then, as I mentioned previously, there's also an HIV symptom guide. And so what this is meant to be is a framework for evaluating certain common symptoms that individuals with HIV may experience. And these guides are typically about a 6-page PDF that offer a summary of important clinical questions and considerations, as well as a decision tree to help with some of the evaluation process. So I'd like to just take a moment here to show you guys the curriculum in live time, because I think that's a little bit more helpful than just showing it on static slides. So what I've pulled up here is just the homepage for the National HIV Curriculum. And as I mentioned, for those who use the curriculum to track their progress, they can go up to the registration page here that takes them to the place that they can register, and then also has the site overview small video. The majority of folks, I would say, usually come to the curricula to use the course modules. So just hovering over here, you can see the different 6 course modules. So for example, I know many of you are working in treatment of substance use disorders. So if you wanted to go to our lesson on substance use disorders, you would go over to the basic HIV primary care module. And under that, lesson 7 would be the substance use disorder lesson. So we click on that. And what it brings up is the lesson, taking you through just sort of background and some definitions and terminology, data sources, DSM-5 classifications, and then getting down into some of the recommendations from the U.S. Preventative Services Task Force for screening and substance use disorders, and then some of the tools that we'll go over here in a bit for screening for substance use disorders. And then further down in this lesson, we outline epidemiology of substance use disorders in the United States, the impact substance use disorders has on HIV and HIV metrics, including viral suppression, and then more specifics about the different types of substance use disorders, including alcohol, opioid use disorder, methamphetamine and stimulant use disorder, et cetera. So this just kind of gives you an overview. If you're interested in looking at these figures, you can click on them here to bring them into a larger view. One of the other really popular aspects of the curriculum are these tools and calculators. So as I mentioned, they're broken up into mental health screening, as well as substance use screening, and then clinical calculators. So let's say you were interested in screening somebody for alcohol use disorder with the audit C. You could click on that calculator and do your screening just in live time here. So it lists out the questions for you and then the answer choices. So if let's say you had an individual who drank 4 or more times a week, and they drank 5 to 6 drinks in a typical setting, and had monthly 6 or more drinks. So you can kind of go through that, and the calculator will spit out the score and then an interpretation of what that score means in this clinical context. The other calculators are very similar. So the creatinine clearance, as I mentioned, is one that I use frequently, and you can go through the pertinent patient characteristics and then get the score here right on this online calculator. I'll just take you through some of the other features here. So the antiretroviral medication section, as I mentioned, is one that is a comprehensive listing of all the different antiretroviral medications that we use for treatment of HIV. If you were to click on, let's see, the dolutegravir lamivudine, for example, it would bring up the FDA prescribing information, including black box warnings here. And I think one of the nice features are these teaching resources where you could go and download a PDF or a PowerPoint of any of these clinical trial slide decks, or you could just go and look at the general slide deck with the overview of dolutegravir lamivudine prescribing information and some of the pertinent clinical trials that led to its FDA approval. The question banks are available to anybody, not just to folks who have registered for the curriculum. And so it's something where you can go through, let's say you wanted to use the substance use disorder Q bank, you could log on here and just go through the questions yourself, just to kind of check your knowledge or check your understanding of the lesson. Although if you do register for it and are tracking your progress, then you can earn CE credits for that. The mini lecture section is new for us, and I really do like this feature as somebody who's a little bit more of a visual learner and who is used to watching kind of short tidbits of information on YouTube or something like that. All of these are in the realm of typically 10 to 15 minutes, a couple of them a little bit longer, like 30 minutes, I think is the longest one. But this is just being built out. So we've got videos on the biology of HIV, some guideline updates, and then antiretroviral medications as well. And then finally, the symptoms guide here. So as I mentioned, these are downloadable PDF guides that go through just a framework for thinking about a specific symptoms in people living with HIV. So cough and dyspnea, odynophagia, diarrhea, headache, and memory changes. And you can just click on this and then it will bring up the PDF here, where it will talk through key kind of clinical history aspects that you would want to obtain, and then may take you through a diagnostic approach and decision tree. So that's the general overview. I'm going to switch back to my slides now. And so let's talk a little bit about users and who's using it. So we have a variety of different individuals who are using the National HIV Curriculum, and across all different kind of provider types. So not just physicians or nurses, but also pharmacists, social workers, medical students, other health sciences students, and folks also who may not be involved directly in HIV care, but maybe taking care of folks who live in HIV, who are living with HIV with substance use disorders or other co-occurring conditions. And so from July 2017 through August 2022, we've had greater than 15 million page views. And what you'll see is that there's been about 2.6 million, or a little over that, sessions in total. And when we break it down by all learners versus registered learners, the registered learners definitely stay on the page for longer, right? These are individuals who are more methodically going through the lessons and earning CE credit. And the average time that they usually spend on the National HIV Curriculum is 27 minutes per session. So where are people located who are using the curriculum? Really across the United States, the East Coast, West Coast, as one would expect, and then also through parts of Central and Northern Europe. And here in the US, the users, which are these little kind of blue dots, really kind of overlay nicely with the areas where there is increased HIV prevalence, which is depicted by the peach and kind of almost rust-colored counties here on the map. So you can see areas in the south and then along kind of the West Coast. So I'm going to switch gears now and talk about the NHC resources for providers treating substance use disorder and those working with people experiencing substance use disorders. So, as you know, substance use disorders are prevalent amongst people living with HIV and can contribute to poor outcomes, which is why we decided to include a specific lesson on this in the NHC. And data from the CDC suggests that in 2017, 30% of people living with HIV had used non-injection drugs in the past 12 months, 2% had used injection drugs in the past 12 months, and 16% had engaged in binge drinking in the past 30 days. So relatively high rates of substance use amongst people living with HIV. And we know that substance use impacts HIV transmission and it impacts HIV care. So use of certain substances, particularly methamphetamine for folks living with HIV, has been linked to increased number of condomless sex acts amongst MSM with HIV. And that, of course, increases risk of transmission for folks who are not virally suppressed. 5% of people living with HIV report alcohol or drug use as the reason for missing their last dose of antiretroviral therapy. So it does have an impact on adherence to medications and to viral suppression. And then people living with HIV who have substance use disorders are more likely to miss clinic appointments, have trouble engaging in care, use the emergency room for care, have suboptimal medication adherence, and then also experience other competing needs like housing and food insecurities. So I'm going to go through some of the clinical tools that are available on the National HIV Curriculum now, and then provide just a brief overview of alcohol and opioid and methamphetamine use disorders in people living with HIV, although really not meant to be a comprehensive review of this. So as you all know, alcohol use disorder in the United States is very prevalent. About 140 million people in the US use alcohol. and 67 million use alcohol in a binge drinking manner, with 16.6 million people categorized as heavy alcohol users. When we look at alcohol use in people living with HIV, data from the 2017 Medical Monitoring Project, which is a project in certain health jurisdictions in partnership with the CDC to get clinical information from folks engaged in HIV primary care. This project indicates that 63% of people living with HIV consumed alcohol in the past year, and 16% engaged in binge drinking in the past month. Similar data from the HIV cost and services utilization study indicate that 8% of HIV positive individuals are classified as heavy drinkers in comparison to an estimated 6% in the general US population. So a slight overrepresentation amongst people living with HIV. And because of how common alcohol use disorder is, as many of you know, the US Preventative Services Task Force recommends that we screen for alcohol use disorder in all adults 18 years of age or older in the primary care setting. And I would say that, I don't think that alcohol screen just has to happen in the primary care setting, right? There are a lot of other places where folks who have alcohol use disorder may engage in care. And so I think this is something that, could also be screened for in different care settings or non-traditional care settings. And the US Preventative Services Task Force recommends that when screening for alcohol use disorder, we use a 1 to 3 question screening instrument. And so examples of this are the Audit C and the National Institute on Alcohol Abuse and Alcoholism recommended single alcohol screening question, which just states how many times in the past year have you had 5 or more drinks for men or 4 or more drinks for women in a day. And if the patient says yes to that question, then they would screen positive for potential heavy alcohol use. And then the Audit C will go through here in a second. So the Audit C is a tool that we have on the National HIV Curriculum. You can go to the calculators page. And this is a shortened version of the Audit, which is a longer kind of screening tool for alcohol use disorder that I believe was initially developed by the WHO. And so this Audit C is a 3-item version of the 10-item audit. And both Audit and Audit C correctly identify 92% or so of persons with hazardous drinking and about 94% of those without hazardous drinking. So as you can see here on your screen, you would just, if you wanted to screen someone using this tool, you would just go through these questions with them. How often do you have a drink containing alcohol? How many drinks containing alcohol do you have on a typical day when you are drinking? And then how often do you have 6 or more drinks on one occasion? And then for interpretations, and this is provided on the clinical calculators section, but for men, a score of 4 or more is considered positive. And identifies somebody who may have hazardous drinking. And then for women, a score of 3 or more is considered positive and identifies someone who may have hazardous drinking. The Audit C does note that if all of the points come from question 1, so for example, if a woman says, yes, I have 4 or more drinks, I drink 4 or more times a week, that would give them 4 points. And so then that would be a positive screen. But if they say they drink, 1 or 2 drinks in a sitting and they never drink more than 6 drinks, the Audit C says basically you can assume that the patient is drinking below recommended limits, and that you can just sort of review alcohol use over the past several months. Another option for screening for alcohol use disorder is the CAGE alcohol questionnaire. This is a 4-item screening tool. And a response of yes to 1 or more of the questions is considered a positive result. So unlike the Audit C, this works well at detecting more lifelong alcohol abuse and dependence, but it doesn't focus quite as much on current alcohol use and isn't as sensitive for detecting hazardous drinking currently. So as you see here, like the questions are a little bit more, have you ever felt you should cut down on your drinking? Have people annoyed you or criticized you by your drinking? Have you ever felt guilty? about your drinking. Have you ever had a drink first thing in the morning? So people may say yes to these questions, but that may be information that's really from the past. The CAGE has also been adapted to include a comment on drug use to jointly screen for both alcohol and drug use problems. And so the CAGE aid is the questionnaire that you would use if you want to combine both CAGE and to screen for alcohol use disorder, and then also include a component of drug use. So for example, instead of have you ever felt that you ought to cut down on your drinking, it would say, have you ever felt that you ought to cut down on your drinking or your drug use? And drug use would be included in all of those questions. And so again, this focuses on lifetime use and does not necessarily distinguish current and prior use. So looking towards opioid use disorder, as you all, I'm sure, are very well aware, we are in an overdose crisis currently in the United States, with a dramatic rise in overdoses due to synthetic opioids, mainly fentanyl. And that's what you're seeing here with this blue line on your screen. And so it is really important that we're focusing on screening for opioid use disorder within primary care settings, since this is becoming really a deadly epidemic for individuals. So opioid use disorder in people living with HIV, we know that injection drug use accounts for approximately 10% of new HIV diagnoses, although the proportion of new HIV diagnoses related to opioid injections versus methamphetamine, for example, is not clear. Older data from CNICS, which is the Center for AIDS Research Network of Integrated Clinical Systems, suggests that 3-month prevalence of opioid use disorder amongst people living with HIV was 2%, although there was a 10% prevalence for polydrug use, including heroin as one of the drugs, and 4% prevalence for injection drug use as a whole. So similar to alcohol, the U.S. Preventative Services Task Force recommends that we screen for unhealthy drug use in all adults ages 18 years or older, typically done in primary care. In particular, they say that screening should be implemented when there are resources available for accurate diagnosis and effective treatment of folks living with opioid use disorder. And the U.S. Preventative Services Task Force does not make a specific recommendation regarding which screening tool to use, although in primary care, brief tools are likely most convenient. So one of the brief tools, and I took a screenshot of this here, this is actually not one of the calculators that we have on the NHC, but is the NIDA quick screen. So NIDA being the National Institute on Drug Abuse. And this just goes through questions about in the past year, how often have you used the following? So alcohol, tobacco, prescription drugs, and illegal drugs. And the answer is really ranging from never to daily or almost daily use. So if the patient says no for all drugs in the quick screen, then that's of course a negative screen. If the patient says yes to 1 or more days of heavy drinking, the patient could have at risk or hazardous drinking. And then if the patient says yes to use of illegal drugs or prescription drugs for non-medical reasons, then they say that you can proceed to an additional tool, which is the NIDA Modified Assist, which I won't show you here, but contains more questions about specific drugs and specific drug use. So one of the quick 2-question screening tools that we have on the National HIV Curriculum is the TICS, or 2-item conjoint screen for alcohol and drugs. And this here asks that in the past 12 months, have you ever drunk or used drugs more than you meant to? Have you ever felt you wanted or needed to cut down on your drinking or drug use? And if the patient answers no to both questions, that's considered a negative screen. And the patient is unlikely to have a current alcohol or drug use problem. If the patient answers yes to one or both questions, it's considered a positive screening result and may suggest a current alcohol or drug use problem. And this tool has been shown to be 79% sensitive and 77, almost 78% specific for detecting a current substance use disorder. So a relatively quick and easy way to screen that's well validated. One of the other tools that I like that is on the NHC is the opioid risk tool. And this is a brief screening tool for clinicians to predict opioid use disorder amongst patients prescribed opioids for treatment of chronic pain. So I know this is one of the most challenging things, right, in primary care is prescribing chronic opioids and really the management and treatment of chronic pain. And so this tool was really designed to try and gauge, what is an individual's risk for opioid use disorder when being treated for chronic pain. And so interpretations here, if they have 0 to 3 points, that's low risk, moderate risk is 4 to 7 points, and then high risk would be greater than or equal to 8 points. And you can see the questions here really focus on age, family history of substance use, personal history of substance use, and then personal history of sexual abuse and personal history of psychological disease, including depression, ADD, OCD, bipolar, or schizophrenia. And so one of the other things I just wanted to mention, although I don't have additional tools to show for this section, is really talk a little bit about stimulant use disorder, since this is more common amongst people living with HIV. So just in general, looking at the entire US population in 2018, an estimated 0.7% of the population over the age of 12, or about 2 million people, had used methamphetamine, with the highest prevalence you see here in these purple bars amongst those 18 to 25 years of age. And then what you're seeing here in the gray bars is cocaine use in the past year, which is much more common in the general population than the methamphetamine use, with about 5.8% of those 18 to 25 years reporting cocaine use in the past year. Stimulant use disorder, however, is much more common in people living with HIV than amongst the general population. And the adult and adolescent antiretroviral guidelines actually estimate that about 5 to 15% of individuals living with HIV have a stimulant, have used stimulants in the United States. And the 2017 Medical Monitoring Project estimated that 1.8% had injected methamphetamine, and just under 5% had used non-injection methamphetamine. And then the CDC NHBS, which is the National HIV Behavioral Surveillance System data, which essentially asks questions of groups that are at risk for HIV and living with HIV. That data demonstrated that HIV prevalence amongst men who have sex with men who primarily inject meth was nearly 50% higher than MSM who primarily inject other drugs. And that's probably due to just higher prevalence, right, of HIV in that population, and then increased risk for sexual inhibition and having more condomless sex acts and a higher number of sexual partners when using methamphetamine, and just the general risk of HIV with chemsex. So screening for methamphetamine use disorder would be very similar to screening for opioid use disorder. A lot of these tools are not specific to the exact drug, but more specific to drug use in general. And then if this initial screen is positive, right, the provider would then get additional information on the types of substances being used and on the frequency of substance use. So as I mentioned, the U.S. Preventative Services Task Force does recommend that all adults be screened for substance use disorder, and this would include under that umbrella methamphetamine use disorder. So some tools that you could consider using for methamphetamine use disorder screening would be the NIDA quick screen that I showed you, that 2-question screen that ticks, and then the CAGE aid, which we talked about earlier under the slides about alcohol use disorder, that asks questions about both alcohol and about drug use. So with that, and I'm happy to we'll have plenty of time for questions, and we can review any more specifics you'd like about the NHC or about the screening tools that are on the curriculum for looking for substance use disorders. But I'd just like to conclude by saying that the NHC is a comprehensive free online curriculum that covers the spectrum of HIV primary care. Owing to the prevalence of substance use disorders among people living with HIV, the NHC does have a lesson dedicated to that, to the management of substance use disorders in people living with HIV, including several substance use screening tools that are available through our clinical calculator section. And then just a reminder that the U.S. Preventative Services Task Force does recommend screening for alcohol use disorder and drug use disorder in primary care, and that there are several open access screening tools available, including those that are found on the NHC website. And I would say that this is not a comprehensive list of all of the tools, but we've tried to select some of the ones that we think are most useful in primary care and are well validated, and ones that can be done relatively quickly, because I know if your clinic's anything like mine, it's always busy, you're always running late. And so, using tools that are 10 to 20 questions long might just not be feasible. And so using these quicker tools that are anywhere between 1 to 3 questions is a way to try and screen folks a little bit quicker and identify people who might have hazardous alcohol use or have a substance use disorder. So with that, I can end my share and be happy to take any questions or comments that you guys have. And thanks again for having me here this Friday afternoon.
Thank you so much. If folks have questions, feel free to use the Q&A and comments as well. You can also put those in the chat. I know a couple of folks have asked about the resources available. They will be this talk and the recording will be posted on the nahu.org website, as well as the PDF of the slides. Liz also has put in the webpage for the National Coordinating Resource Center that has additional resources on substance use disorder. And I guess we could put in there the link directly for the NHC as well.
Yeah, I will put that in right there.
There we go. Perfect. So there we go. So thank you very much, first of all, I mean, for the overview for the, the National HIV Curriculum, but also then your in-depth exploration of substance use disorder screening, but also the numerous tools that folks have access to. And I just want to say it from our perspective too, at the AETC program, we've found the NHC, the National HIV Curriculum, to be invaluable. Both, it's available both for the longer in-depth, as you said, lessons, but also the calculator page and the screening tools are wildly popular, I know, among providers, because it's such easy access, 24/7 on the web. So it's encourage everybody to utilize this resource.
Yeah, and I'll just mention too that I think I utilize these tools frequently, but sometimes it may be more clear, right, that somebody clearly does have a substance use disorder, or you may be working in a setting where that information is gleaned very easily. But I think the nice thing about some of these screening tools is that it really just kind of standardizes things. And I think that if you're going through, if you're in a general primary care setting, it's helpful to say, hey, these are questions that we ask of everybody. And so I do like the fact that by using screening tools, well, maybe not always necessary, depending on your practice location, it can provide more of a standardization and try and destigmatize some of the questions that are being asked, which is always what I try to do, so that folks feel that I'm really invested in their clinical care, and I really do want to understand what they have maybe been struggling with, and this is a way to do that.
We do have a question that was posted. Is there a great one-pager or brief document you would recommend that includes an overview of how substance use disorder intersects with HIV, vice versa?
Oh, a one-pager. Oh, that's a good question. I don't know. I don't know of any good one-pagers off the top of my head. But the CDC has a nice website that just goes over risk factors for HIV, and it does have some information on the intersection between HIV and injection drug use in particular, not necessarily substance use disorders as a whole. So that could be a good resource. The NHC lesson is a bit more than a page, and probably maybe providing more information than someone just looking for a quick one-pager. But if I find something, I will let you guys know.
Thank you. And Julia is just reminding us that the tools are also accessible on mobile phones.
Yes, thank you, Julia. Julia is one of our colleagues here at the University of Washington, and really helps us with management of the CE credits, and also helps with just advertising and getting the word out about the NHC and other curricula that we have. And I'll say too, if you're somebody who's using, maybe you see folks living with viral hepatitis, so Hep C or hepatitis C, a lot of the same clinical calculators, not all the substance use disorder ones, but a lot of the same general ones like APRI, FIB4, creatinine clearance, for example, those are available on some of the other websites as well.
And I see Liz has put in the chat as well the evaluation for the session. We welcome your feedback, but also if you want continuing education credits, please complete that within 2 weeks of today's session. And again, oh, great. And Liz, also from the National Resource Center, we have the HIV Care Settings Toolkit, Substance Use Disorder Services in HIV Care Settings Toolkit. Another link. And right on cue, I'm being prompted for the next session. So please join us on Friday, February 3rd at noon Eastern, when the series topic will be psychedelic assisted treatments for substance use disorders and mental health. Well, thank you again, Dr. Corcoran, for a fabulous talk and links to fabulous resources. So appreciate your time.
Yes, thank you guys so much for having me. I appreciate you being here on a Friday afternoon. And I'll throw my email in the chat if people have any additional questions. I'm happy to, to answer them, and hope that you learned a little bit more about some of the resources that are out there and are available to you. So again, thanks a lot.
Thank you, everybody. Thank you for joining us. Have a great weekend.
Bye-bye.